Can cystic fibrosis newborn screening give a false positive? Can newborn screening for cystic fibrosis really give a false positive? Yes, it can. This means that the screening test might suggest a baby has cystic fibrosis, but they may not actually have the disease. Newborn screening for cystic fibrosis usually involves a two-step process. First, a blood sample is taken from the baby to measure a substance called immunoreactive trypsinogen, or IRT. If the IRT levels are elevated, it raises suspicion for cystic fibrosis. However, high IRT levels are not specific to cystic fibrosis alone. If the first test shows high IRT levels, a second test is performed. This is typically a genetic test that looks for common mutations in the cystic fibrosis gene. If one or more mutations are found, the screening is considered positive. However, this does not mean the baby has cystic fibrosis yet. Further diagnostic testing is needed to confirm or rule out the disease. False positives are relatively common in newborn screening for cystic fibrosis. Research shows that around 90% of babies who have a positive newborn screen do not actually have cystic fibrosis. Instead, they may be carriers of a cystic fibrosis gene mutation. Carriers do not have the disease themselves, but they can pass the gene to their children. Several factors can lead to elevated IRT levels, contributing to false positive results. For instance, perinatal stress or other medical conditions can cause an increase in IRT. Babies with low APGAR scores, which assess their health right after birth, have been found to have higher rates of false positive IRT results. It is crucial to remember that a positive newborn screen is not a definitive diagnosis of cystic fibrosis. Confirmatory testing, especially the sweat chloride test, is essential. This test measures the amount of chloride in the sweat, which is typically elevated in individuals with cystic fibrosis. In conclusion, while newborn screening for cystic fibrosis is an important tool for early detection, it can produce false positive results. Positive screens must always be followed by definitive diagnostic tests to confirm whether a child truly has cystic fibrosis. This careful approach helps identify infants who are affected while reducing unnecessary anxiety and interventions for those who are not. Always consult healthcare professionals for personalized advice and information.